Yeah, and setting up, and should be ready any moment. The bar is going. And okay, we're good.
We're good.
Okay.
All right.
Okay. So I just want to
let's talk about the logistics of what we're doing.
Okay, go ahead.
It's a little different than what you may be used to.
Okay, go ahead.
We're doing a Facebook Live, and that is information, things you can do, kind of a global thing. Although we're not believers in global tapping, we're going to do it as, we're going to come up with a way to do it as a group and give you some tips and information that's going to be very valuable for you in these times. And then we're going to get off of Facebook, because right now this is all being recorded on Facebook. We're going to get off of Facebook. We're going to just stick with Zoom, and that will not be recorded, so that I can work one-on-one with some of you, with at least one person, and all of us can borrow benefits and sort of learn also learn, like there are a lot of students in this group, and so we're here to yeah. So
okay, all right, so that's how we're doing it. So we're going to have the information first, and the focus today. So the focus today is really, as I was just saying a moment ago, but just repeating for Facebook Live, is we're going to be focusing on anger. Next time, I think we're going to be working on either isolation or scarcity. And anger right now, what we were just saying, is really showing up in a lot of ways. I'm seeing it on social media like crazy. The infodemic that's gone viral is just making people so angry. And the anger might be directed at any number of sources. It might be directed at the federal government, or state government, or governmental bodies, or the CDC, or the World Health Organization, for how they're handling the situation. Whatever your perspective, anger's coming up for that. It might be much more personal to your community. The way, as Alina was saying, people are getting so angry at postal workers for delays, or cashiers for not having things in stock at their stores. You know, in Australia, we're seeing people, for example, that are angry and having fights over toilet paper. It kind of went viral. But anger is showing up in other ways. People are not showing appropriate distancing. Yes. Right? And so with that, people are getting very angry for people that are being unaware of keeping social distance.
Right. Healthcare workers and first responders are getting angry because people aren't listening to stay home orders.
Exactly. People getting angry at family members, children that aren't following and thinking that they're immune to this.
Right.
Elders that somehow feel immune to this. I'm hearing people all the time. A young man I was just working with the other day and was saying, I went and looked at this place, and there were so many seniors there. I couldn't believe it. Did they not think that they were going to be affected by this? So a lot of anger is happening out of people feeling justified, feeling right, following the rules or not following the rules, or thinking the rules are wrong. And it's bringing up, you know, this sense of being out of control that's resulting in a lot of anger. Why is this really important for your health? Because anger suppresses your immune system. There was a Harvard study that showed just recalling a memory of an angry episode can reduce the immunoglobin A in your saliva for up to 6 hours. And that's just recalling a memory, let alone just living in the anger. We have one study that showed that EFT increased immunoglobin A 113%. That was the study, the physiological responses study by Dr. Stapleton. So when we look at the importance of anger with regard to immune response, really critical that we get this under control here. It's not saying that anger isn't a natural emotion. We just don't want to have anger and have it stay there for lengthier periods of time. Reducing our stress levels with EFT is just so important. For those of you that haven't seen the infographic or study that came out also by Dr. Stapleton, it showed that group tapping, as we're going to be doing here for a period of time, reduced cortisol by 43%, which is a huge drop in stress hormone levels. So when we're using EFT to reduce stress, to reduce anger, we are helping our immune system. That's really important right now to help to prevent the onset of COVID taking over us, and for sharing it with our loved ones as well, how to do this. You know,
I wanted to share something about anger and how interesting it is. You know, you can explore anger as what is it that you feel is very important to you. So anger is there to have us pay attention, to realize maybe what your values are. So instead of, I definitely we're going to be due to tapping, and tapping is the most amazing tool. But after that, why don't you ask yourself, take it a couple of layers deeper, and ask yourself, if the anger that showed up for me because someone in my family had, I'll give you a real live example. Someone in my family had a panic attack because they did not follow my advice to not do something, and they had a panic attack. And so I work on it for sure, but then I step back and I say, well, what does that say about what's important to me? That person is very important to me. I want them to feel safe. And that's what triggered the anger. So I have more compassion for myself. And so anger is appropriate because it's sort of like if you get into the feeling of anger, it's like, I've got to do something. I've got to move this anger through me, and I've got to utilize it for a good purpose. And as Craig said, the problem is when we get stuck in the anger, because anger motivates. Anger changes our lives. Anger really has us see, like, okay, what's important to me?
And it activates.
It activates. Totally. Yep. It's totally like this energetic. And I would say that now is a perfect time to learn about the person in your life that is most influential in how you are going to deal with this crisis and the repercussions of it, and the person in your life that has the most influence on your reality in all of this, and that person is you. It's a great opportunity for you to learn about yourself and your shadow, because I see it coming up with clients, like now especially, that how much they're stirred up by things happening when they're with their family. And so go and learn something new. Find what resources are really helping you to move through that anger. So I've just been learning about human design, and that I'm a manifesting generator. And one of the things I realize is I need to move more. I need to get that energy out and feel exhausted. But other systems that you could be learning about, Ayurvedic medicine talks about the different doshas. So if you're a Pitta, you're more likely to be angry right now. And if you're Vata, then you are more likely to be anxious and fearful right now. And if you are Kapha, then you are more likely right now to go into sadness and kind of feeling depressed. So Enneagram is another one. So what are you doing right now as me as a 3 with a 2 wing? Well, I'm trying to help as many people as I can. And I've got these webinars going, I've got these classes going, and these ideas are just flowing out of me. But I know that can lead to crashing. And so I'm really doing a lot of self-care and finding the things that really help me. So find resources for yourself and go learn something. Go find out more about yourself, because really, again, it has the greatest influence on your health, your safety, your reality, how people connect with you. So really learn about yourself now. So aside from asking yourself, okay, what is being called upon me and stirred up in me? What value do I have, and that's why I'm angry? The other really deep level question to ask yourself is, who is that representing? Like, I know that 4 years ago, I was so angry. And there were things in the world, and when I saw, man of a certain age, I'm mad at this one over here, man of a certain age. And I asked myself, well, who does that remind me of? And there was so much more that was left that I thought, I had processed
from before that.
Oh, from childhood. So I'm asking you I invite you to look at the deeper layers of this, and what is that anger really all about? What does it represent? What does it remind you of in order to get to the deeper layers?
So like if, for example,
Yeah.
somebody's coming up and they're at the grocery. They've made their one trip for the week to the grocery,
Right.
They planned it methodically, so they don't need to leave the house. They waited, they planned, and they get there, and they have somebody that like keeps standing next to them.
Right.
And then they're, I just had somebody said I was staying 6 feet away from the cashier, and this person just like walked in front of me, and they said, "Hey, practicing social distancing here," and the person started mouthing off at them,
Right.
and
Yeah.
giving them attitude,
Yeah.
and person got angry.
Yeah.
As response. So of course there's a reasonableness for the anger in the moment or the response,
Right.
but what else is about that? What else is connected to somebody or people being not mindful
Right.
or not respectful or whatever his version was that
Right.
has a history to it?
Yes. Yes. So I think we're going to do some tapping here to help you. And this is a technique, because EFT is emotional freedom techniques. We are only sharing in our Facebook group and on these live sessions, clinical evidence-based EFT. Yesterday, I mean, that's one thing that gets me angry is all of the different versions of tapping that people are calling EFT. Like I read somewhere yesterday, somebody was saying tap on the back of your hand and that's EFT. No, it's really not. So we're really, and there's some history there, and I just got an inkling about what that's about. So, but I want, let's do something called Tearless Trauma. So I invite you to go wash your hands. Go wash your hands. If you're following guidelines for not touching your face, maybe Craig can you do the tapping?
There you go. You want to do the point, which one I'll do the non-facial tapping and you do the facial tapping if your hands are washed?
Why don't you lead me?
Okay. In which way?
And you can do can you do something that I'm not doing? Can you kind of track that? I know for me it's hard.
Right. So
if you do the tapping on your face,
yes,
I will do the
that's what I
non-facial
was
tapping.
Great. So we'll show you both versions.
Okay. So we're going to do a technique called Tearless Trauma, and it doesn't have to be about trauma. You're just going to create something that's think about something that's made you angry in the last week. You read something, you saw something, and I want you. Yeah.
I got it. That wasn't hard.
No. Okay. And I want you to give it a level of intensity. How angry are you when you think about that? 0 to 10. 10 is really high anger. 0, no anger at all.
We have a brand new puppy running around.
Let's show her. Come here,
Yeah.
baby.
Come here.
Come here.
Anyway, so what we're going to do is you're going to give it a 0 to 10. 0 being no anger, 10 being the top amount of anger. And so you're going to rate that. We call that a SUD score.
Here's our oxytocin hit for the day. Hi, BB.
Hi, BB. Yes. Yes. Yes.
Okay.
All right. So we're going to have to manage. If you hear a bark in the background, that's what's happening.
Yeah, and she really calms down when she sees that we're tapping. So really if for nothing else, if you are at home with your children, you should be tapping on your anger regularly, because they are so sensitive to those things, and for your animals as well. Okay.
So we didn't name.
So keep your eyes open, and you're going to tap along. So write that anger 0 to 10, put that aside, and repeat what we're asking you to repeat. And I'm actually going to title the anger that I have about something.
You're going to give it a title? Okay.
So my title is Let 'em Eat Cake Moment.
Okay.
Yeah.
All right.
Okay.
And that's fun because I don't even have to know what it means.
Yep. And so again, keep your eyes open, tap along, and we'll see what happens at the end of this. So.
Okay.
All right.
Even though I feel this anger.
I feel this anger.
About that let 'em eat cake moment.
About that let 'em eat cake moment.
Good. I still deeply and completely accept myself.
I still deeply and completely accept myself.
Good. Even though I have this anger.
I have this anger.
Thinking about that let 'em eat cake moment.
Think about that let 'em eat cake moment.
Good. I still deeply and completely accept myself.
I still deeply and completely accept myself.
And even though I have this anger.
I have this anger.
This feeling of anger.
This feeling of anger.
Thinking about that let 'em eat cake moment.
Think about that let 'em eat cake moment.
Good. I still deeply and completely accept myself.
I still deeply and completely accept myself.
Okay, I'm going to start at the top of the head.
Yep.
This anger.
This anger.
Good. I'm going to go to the beginning of the eyebrows right here. This anger.
And I'm going to my collarbone so I don't have to touch my face. This anger.
Good. Side of eye. This anger.
Under the arm. This anger.
Good. I'm going to go under eye. This anger.
Liver point under the breast. This anger.
Good. Under nose. This anger.
I'm doing the wrist. This anger.
Good. Chin point, this anger.
Do the top of head again. This anger.
Good. I'll go to collarbones, this anger.
This anger.
Good. I'm going to go underarms here.
This
All
anger.
this anger.
This anger.
Good. Now, did I ask you what your anger level was before we started?
To guess at it, yeah, it was about a 6.
Okay, so guessing at your anger is a 6 because we're just trying to keep a little bit of distance from it and not close our eyes and dive into it.
Right.
So right now after tapping,
Yeah.
0 to 10 guessing at.
3. It's probably 3.
Good. Why don't we do another round?
Yeah, for sure.
BB Speed Racer.
Okay.
Even though
I
still have some remaining anger.
I still feel this remaining anger.
Good.
I still have this anger, this moment.
Yeah. Thinking about that let 'em eat cake moment.
The let 'em eat cake moment.
Yeah, I still accept myself.
I still accept myself.
Good, even though I still have some remaining anger.
I still have some remaining anger.
Thinking about that let 'em eat cake moment.
Just thinking about that let 'em eat cake moment.
I deeply and completely accept myself.
I deeply completely accept myself.
And even though I still have some remaining anger left.
I still have some remaining anger left.
Good. Just thinking about that let 'em eat cake moment.
Just thinking about that let 'em eat cake moment.
I still deeply and completely accept myself.
I still deeply and completely accept myself.
Good. I'll go to the top of the head. This anger.
This anger.
Good. Eyebrow, this remaining anger.
This remaining anger.
Good. Side of eye, this remaining anger.
This remaining anger.
Under eye, this remaining anger.
This remaining anger.
Good. Under nose, this remaining anger.
This remaining anger.
Chin point, this remaining anger.
This remaining anger.
Collarbone, this remaining anger.
This remaining anger.
And under arm points, this remaining anger.
This remaining anger.
Okay, so right now, just thinking about that, whatever it was for you, that let 'em eat cake moment, guessing at the intensity of your anger right now, after doing that next round, was a 3. What is it right now?
It's a 0.
Yeah?
It's a 0. And two thoughts came up, which are really funny. I got to share. So one is I was feeling a little angry about the fact that I see so much, less than optimal, versions of tapping out there, right? Well, we just screwed up. So my anger, often your anger is a projection of what you're doing that you're not willing to see. And so that wasn't tearless trauma. So anyway, that's really funny. So that thought came up. And then the second one was, I'll tell you what the anger moment, the let 'em eat cake moment was. I heard about an Instagram influencer who had to cancel her yacht photo shoot because the photographers and the makeup artists and the hairdressers that were going to be there for this person canceled because of stay-at-home order and social distancing and all of that. And this Instagrammer was just ranting about how this was just going to affect her 7-figure income for this year. And that was and so when I released that and it came down to a 0, now I feel more compassion because I know that a lot of those Instagrammers are really underneath it, are really having to face the things they've been distracted from, which is their lack of self-love. And that's why they're projecting all of that into the world. So I have a lot, and all the trauma associated with that, of not feeling good enough. So I got that, and I'm just like, it's a 0. I have compassion.
Yeah. You want to make the correction for tearless trauma?
Yes. So tearless.
I was following your lead on that one, baby. I thought you wanted to do something a little unique.
All right. So there we go. We are not infallible. We make mistakes too.
And what we did is a fine way to tap. It's just not officially tearless trauma.
Right. So for tearless trauma, what you want to do is you have an event in mind. You write down guessing your level of intensity, 0 to 10, and then you tap on even though there's this event. There's no emotion. There's nowhere in the body. For anger, it might not be, it's not as dangerous to do it with an emotion because we're not working with a trauma. But just in case you do this with other applications or other events, just be a little distanced and dissociated from it by tapping on this event and not including any emotion. So there you go. We messed up. It's okay.
And we're actually getting a request from somebody to show where the points are that are below the screen.
Yes.
And so there were 2 points that were difficult to see. So I'll show you both. If you go to the armpit and you drop down 4 inches right down the midline, here's the underarm point. And you can do it either on one side or on both sides or on the same side. And there's also a liver point that is literally right underneath the breast for a woman right here. So it would be right here. And so we're just tapping on these points. We often don't use those in regular basic EFT, but we're looking for other tapping points that we can use other than the face. And the other point that Alina did that you should have been able to see was literally either tapping on one wrist or the other or both at the same time. So these are additional points that aren't always used. Another option that we haven't shown that you can add if you're working with yourself or somebody else and don't want to do the facial touch points, are also the finger points. And you can either squeeze the finger points, kind of the nail beds on either side, or you can go ahead and simply tap on the fingertips where the nail bed meets the nail, meets the finger. So those are just some options.
Okay, so let's take a couple of questions, and then we're gonna just take drop out of Facebook Live here so we can have more privacy.
And you have both webinar questions, but you might also have Facebook Live questions.
And there's no way for me to actually look on there.
Okay, at the same time.
I just don't want to. But if somebody sees a question on the Facebook Live,
we'll answer it afterwards.
Want to post it, yeah, we'll answer it afterwards, or you can actually put it up on the Zoom chat if you see something on there. Okay. Any questions?
Not seeing any right now, but we'll come back and answer later.
Okay.
Okay.
So we are going to drop out of Facebook and get more personal. Thank you all for joining us on Facebook Live. If you are looking for joining us in the webinar on Zoom, now go ahead and use the link that I put it up as an event, and I shared it on my timeline, and it's in the EFT Emotional Freedom Techniques group.
Also, just let people know that on Saturday,
yes,
what we'll be doing as well.
Saturday, we're doing a 3 hours EFT for self-care, and you'll have the recordings and the handouts and all of that to keep as well. So you can find that on EFTtappingtraining.com. All right, thank you all for joining us, and next week we'll be back here, same time, same station.